All right. Well, welcome everyone, and thank you for joining today's fourth webinar in our children's health public health sessions. And today is going to be on the heat and health warning systems. We're really excited to have the three speakers that we do have. My name is Dave Edwards. I'm the Chief Deputy Director here at OEHHA. And I'll be giving some opening remarks, and then I'll turn it over to Rupa, who will be our facilitator today. So yeah, once again, thanks for joining. And for those of you in Sacramento, it's supposed to be 108 today. So I think this is definitely a very appropriate discussion to have today as we're looking into how warning systems work and how they can benefit children and pregnant women. Before I get into a little bit of some of the sort of higher level background, I did want to also highlight that the Children's Health Environmental Center just last week released its legislative report, and that could be found on the Children's Health webpage here on our OEHHA. Maybe Rupa or Mark, if you could stick the link in the chat, that would be great. That goes to the report. And that's really exciting. It's a culmination of the last couple of years of work, so that the Children's Health Center has been working on. So today we're going to be really doing a dive into looking at heat warning systems across the world. We have three great speakers, Francesca, Nicole, and Reid, that will be able to talk to this topic, and we hope to have a really good discussion after their initial remarks. I did want to provide a little bit of context regarding the state and what's going on in California. Last year, Assembly Bill 2238 was passed, which tasked Cal EPA and OEHHA to develop an extreme heat ranking system for the state by 2025. And so this talk is really appropriate as we're just getting into the beginning phases of thinking about the different types of options that are out there for heat warning systems and what it actually looks like on the ground. There's been a couple of interesting articles in both the New York Times and LA Times recently that talk about what an extreme heat ranking system could look like in California as well as the rest of the country. So we're really excited to have these three speakers. And with that, I will turn it over to Rupa.
Thanks so much, Dave, for that introduction. I am just going to try to share my screen here. See if this works. Okay, and okay, so welcome everyone. This is our fourth and final session of the Children's Health Symposium on heat. We were focusing on this one on impacts on children and pregnancies. I want to say that the videos are available on our website for the previous sessions on pediatrics, pregnancy, and strategies. And today, as Dave said, we'll be focused on warning systems. So the title of today's symposium is Heat Health Warning Systems and Important Considerations. Today's agenda is, we already heard Dave give his welcome. I'm going to give you a very short intro because we're very excited about our three speakers today and want to give them the chance to give their presentations. First, we're going to have Reid Wolcott from NOAA's National Weather Service Tools for Heat Warnings. He will be giving a talk for about 15 minutes, then followed by Nicole Errett, who will be giving a talk on heat warning systems and action plans in the US. And finally, from Francesca Donato, lessons from 2 decades of heat warning and action plans in Italy and Europe. And then I will be moderating our panel. And for those of you who don't know me, I am OEHHA's section chief on the air and climate epidemiology section. And we really want to emphasize for people to ask questions here. You could ask questions. We'll have just a couple clarifying questions if there are any after each speaker, but we're going to save this all the questions until the end. If you have questions feel free to add them to the chat, or if you want to raise your hand and we'll call upon you, please feel free to do that way as well. And that is it for me. I'm going to just, if Reid, you want to share your screen, I will give a brief introduction. Mr. Reid Wolcott is the warning coordination meteorologist with the National Oceanic and Atmospheric Administration and National Weather Service in Seattle, Washington. He holds a Master's of Atmospheric Sciences and Meteorology degree from the University of Washington. He's had several roles with the National Weather Service previously, including being a forecaster and supporting first responders. And in his current position, he's a primary liaison between the National Weather Service and partners throughout Western Washington. We are so honored to have you speak today, and go ahead and take it away, Reid.
Awesome, thank you so much. Can I get a quick confirmation that you can see my screen?
All good.
Awesome, thank you so much. Yeah, so my name is Reid Wolcott. I am the warning coordination meteorologist at the Weather Service office in Seattle. And today I'm going to talk a little bit about extreme heat, what makes it so bad, kind of the contributing factors that go into impacting human health. And then more specifically, I'm going to dig into some of the resources and the metrics that we use at the National Weather Service, specifically in the Western US, to describe heat and warn about that heat. So I think most everybody on this call is probably familiar with heat as a hazard, but just a really quick refresher, heat is the #1 cause of weather-related fatalities in the US and really globally. It can cause a number of heat-related illnesses running from the, relatively insignificant and something like heat cramps, all the way up to the life-threatening and heat stroke. Heat alone can also cause reductions in air quality. I'm not going to go into that today, but it is something to be aware of, especially in some of our less urbanized areas. Heat also has an impact on our infrastructure around wherever the heat event is occurring. It can cause damage to bridges, roads, railways, power and telecommunication lines, all of this through thermal expansion. We also see a strain on power systems during significant heat event due to all the additional air conditioning and other resources being used during our heat events. We see a rapid increase in wildfire danger and sometimes wildfire activity as well. And it can cause additional impacts to our economy in the form of impacts to agriculture, aquaculture, etc. Heat can be exacerbated by what's known as the urban heat island effect. And I know Nicole will be talking a little bit more about this in a bit. But this is where we have significant warming in urbanized area due to human activity. So all that concrete, asphalt, metal, etc. Is a really good, it captures a lot of heat and it radiates that back out at night. So especially during the overnight hours, we can see temperatures on the order of 15 to 20 degrees warmer in our urbanized areas compared to our more rural areas. Another contributing factor, and there are some places in California that see this, but one of the reasons that I'm here today is because of this statistic right here. So back in 2021, you may recall that we had a very significant, what we call the heat dome event. And at that time, Seattle itself, less than half the homes in the Seattle metropolitan area had access to air conditioning. That has since begun to increase. We're now over 50%, thankfully. But at that time, less than half the homes had access to air conditioning, which has very significant ramifications for all of those people that are living without air conditioning. And part of the reason for that is because of indoor temperatures. We focus a lot on what's going on outside and the overnight low temperatures, the daytime high temperatures, all these sorts of things. But what's really important for these folks that don't have access to air conditioning, myself included here, is the indoor temperatures. And up here in the Northwest, and this is really the same anywhere where we have a relatively temperate climate, so the coastal areas of California fall into this camp as well, is that the homes are designed to let in and retain heat. We have a lot of south-facing windows, we have really good insulation, etc. So for those homes that don't have air conditioning, we typically don't see indoor temperatures peak until well into the evening hours. Right now, just as a reference, we're going through a heat event right now. My indoor temperatures at my house are not peaking until about 8 o'clock at night. For a very extreme event like our heat dome event back in 2021, that gets pushed back to 10, 11, or later at night. And even when we can open the windows, when the temperature outside falls below the temperature inside, the indoor temperatures are only going to cool as fast as the outdoor temperature cools off. So the other thing to keep in mind here is that indoor temperatures in these environments can climb high enough such that fans alone cannot provide adequate cooling to cool off the human body and mitigate the risks associated with heat. So that's one thing that's really important to remember. So all of these factors need to be taken into consideration when considering mitigation strategies like opening up cooling centers. That was a big problem that we had up here in the Northwest in the heat dome event of 2021, is that we were closing our cooling centers at 5, 6 o'clock at night, sending people back to their residences or wherever they happen to live. And we still saw the temperatures increasing for several more hours. And so that's something that we definitely need to consider, is when are we applying these strategies? So I talked a little bit about this, but the reason I'm here today is because of this particular event. Since the June 21 heat event, the Pacific Northwest heat dome event, a lot of my job has been centered around what do we do about heat? How are we messaging heat? How are we working with our partners? And the reason for this is it was so far outside of the climatology. It broke all of the records. It broke daily records, broke monthly records. It broke all of our all-time records, including the state's highest temperature ever recorded at 120 degrees. So this was a massive, massive event with tremendous loss of life. I know in Washington State during the summer of 21, we lost over 150 souls due to this heat dome event. And I was not excluded from these impacts. You know, as I mentioned before, I've never lived in a home with air conditioning. These are a couple of snapshots of me sheltering with my 3-year-old and my 2-month-old at that time during this heat dome event. I had to work. It was a Monday. I had to work, but I was able to go to a friend's house who did have air conditioning, and I worked with these 2 small children while my wife was out at her office as well. So even us meteorologists, we can't escape this. And this is why I wanted to jump at this opportunity to speak to all of you today. So what do we do about heat as far as messaging, metrics, etc.? So at the National Weather Service, there is a lot of different metrics that we could use. There's the ambient temperature, which is just what you see when you look at the thermometer. There's heat index, there's wet bulb globe temperature, there's heat risk. There's a lot of other systems out there. The 3 most commonly used by the Weather Service across the country are heat index, wet bulb globe temperature, and heat risk. So those are the 3 I'm going to briefly talk about. Heat index, you've probably heard of before. It's the traditional feels like temperature. It's what the human body feels when you combine the temperature and the humidity. And so, you know, when it's really hot and sticky out, you feel warmer than if it's hot and dry outside. However, heat index is best applied to areas that do experience significant humidity when there's a heat event. That does not happen very often here in the Western US. In addition, it requires a long humidity climatology to kind of normalize that. Again, the records here in the West are much shorter than those periods of record out on the East Coast. So for a variety of reasons, we don't traditionally use heat index in the Western US. There's also the wet bulb globe temperature. This is a parameter that estimates the effect of temperature, humidity, wind speed, and solar radiation on the human body. This is a very useful metric, but it's hyper-localized. You can measure it on a road and a park right immediately adjacent to that road, and you'll get 2 very different readings because of the radiation from the ground. So it's very hyper-localized. Its thresholds are typically geared towards healthy, acclimatized, and physically active people. So it's very useful for making decisions around athletic events, outdoor workers, the military, etc. And there are a lot of thresholds out there for those folks. But it does not apply well to the general populations, and specifically our most vulnerable population, including pregnant individuals and children. So for those reasons, we do produce forecasts of wet bulb globe temperature, but we don't typically message on the basis of wet bulb globe temperature. What we do use in the Western US, and this is common across all Western US Weather Service offices, is the heat risk system. So this is a multi-tiered system, much like the Air Quality Index, that is aiming to put heat into an actionable, impacts-based context to provide decision-making support at a local level. So heat risk takes into account a number of different factors, including the local climatology. All of those blue dots you see on that map on the top right are locations to which heat risk has been localized. So we know that a red level heat risk day in Phoenix, Arizona is expected to have the same relative impact on the population as a red level day in Seattle, Washington, even though the temperatures may be different on the order of 20 to 30 degrees. It also takes into account the time of year, because we know that a heat event in May at 90 degrees in Seattle will have much more severe impact than a 90-degree day would here in the middle of August. So there's actually a curve. It's not a static threshold for each one of these categories throughout the year. It takes into account the forecast high temperature for obvious reasons, but it also takes into account the overnight low temperature, which is, again, very important, especially for those regions that don't have access to air conditioning. And then it also takes into account the event duration. We know that a one-day event won't be as severe as a 3, 5, 7-day event would be. And then it takes all of that data and combines it back to CDC's heat health thresholds that help identify at-risk populations at these different levels of heat. And this is the tool that we use as our primary driver for National Weather Service watches, warnings, and advisories. So then we've got, this is just a sampling here of some of the thresholds that are used for the high temperature and low temperature in a few locations. So I've got Seattle here just because I'm, again, in Seattle, but also just for reference here, what those curves look like for Sacramento and Death Valley. This would take an entire half hour to go through what all of these graphs mean, but just know that these are available to you should you want to dig into them. And I can provide links. In fact, I think there was a link on the previous slide. Heat risk is also very good for situational awareness because it goes out to 7 days in advance. Unlike other heat warning systems, heat risk is available out to 7 days. You don't have to rely on the alerts being issued in order to take actions. A lot of times the alerts may trigger actions, and then we'll use the heat risk to identify what actions need to be taken. But you can prepare for those in advance with the heat risk system. And the last thing here is, one of the last things here is, again, those watches, warnings, and advisories. And just a quick refresher for those that may be unfamiliar, we have watches, warnings, and advisories. The watches and warnings are the big bad. That means something's really significant coming up. And you can compare that to the taco watch, taco warning graphic that you see here, where the watch means we're not sure exactly where it's going to happen, but we know the ingredients are in place for an event to occur, in this case, heat. Whereas a warning means, hey, it's taco time. It's time for it to actually take some action. We have a lot of specifics about the impending event. An advisory is issued for lesser events that could still have an impact on life and property, but generally are less severe than a warning level event would be. And I want to close out here with the importance, the expertise or the information that we gathered from our heat event, the after action reviews that came out of all of that. And really highlighting the importance of gathering expertise from other parties, other individuals. It's really easy to fall into this Dunning-Kruger effect that I'm showing here, where you have a lot of confidence that you know something about that, but your actual competence in it, you haven't spent your career working on this. And this is something we're susceptible to here at the Weather Service, trying to make guidance around heat in a vacuum just at the Weather Service. We can't do it. We really rely very heavily on our public health partners to bring that additional competence to the table and understand all of the factors that need to be considered when making heat-related decisions. And this really came to bear when we started working with our public health partners here in Seattle and King County here in Washington State, when they came to us with their first draft of heat-related mitigation strategies, and they were based off of, weather data that was just not even climatologically realistic. Meanwhile, we were also trying to come up with recommendations on what people could do, but those weren't realistic either. It took us both coming to the table and coming together to align the public health and weather service recommendation strategies to come up with a document that then we could share with all of our emergency response folks, our emergency managers across the county and the city of Seattle for recommended actions based off of the different levels of heat. So this is an example of some of the recommendations and considerations that are made that are directly tied to the heat risk system. And these are the actions that are in place literally today as we are experiencing an extreme heat event up here in Western Washington at this time. And I've highlighted here some of the key considerations and recommendations in this documentation from Public Health Seattle-King County that are dealing directly with children and pregnant and other vulnerable populations. So with that, I will just close out with key takeaways here. No one agency, and this I really want to stress this, no one agency can tackle heat. It takes a community of expertise that needs to be leveraged in order to make decisions around this. And I really strongly encourage you to take a multidisciplinary approach as you move forward with this sort of effort in the state of California. And with that, I will leave you with my contact information as well as our liaison office there in Sacramento, as well as our Regional Operations Center, which also serves Cal OES as well. And with that, I'll turn it back over to you, Rupa.
Thank you so much, Reid, for that excellent presentation. I know we had some technical issues. I hopefully got those resolved with the slides advancing. I want to know first if there's any clarifying questions for Reid. I don't see any, so we are going to thank you again, Reid. Move on to our next speaker, Dr. Nicole Errett. She is an assistant professor in environmental and occupational health sciences at the University of Washington. She holds a PhD in health and public policy, an MSPH in health policy, and a BA in public health studies from the Johns Hopkins University in Baltimore, Maryland. She completed postdoctoral training in coastal community resilience at UBC, and she currently co-directs the collaborative on extreme heat resilience at UW, and nationally, she co-chairs the NIEHS Disaster Research Response Network Steering Committee. Her research focuses on the development, implementation, and health impacts of policies and programs that aim to build resilience in the context of public health, emergencies, disasters, and climate change. Welcome, Nicole. It's so great to have you here. Thank you.
Thank you so much, Rupa. It's great to be here. I'm going to talk today about some work that we've been doing nationally in partnership with a number of groups, including the National Association of County and City Health Officials, to understand how local jurisdictions are preparing for extreme heat and what are challenges and opportunities that they're facing. And we focused for the initial part of our research, which was a national survey for jurisdictions over 200,000 in these urban larger jurisdictions for a couple of reasons. And so one of the reasons was that, as Reid pointed out, cities are particularly vulnerable to extreme heat events because of the urban heat island effect, which results in urban temperatures being higher than suburban or rural areas. We also know that climate change is going to increase the frequency and intensity of these extreme heat events. And so it was of importance for us to look in these places that had a lot of folks living in them. We also were doing this survey. It was kind of a first of its kind survey to understand how jurisdictions were preparing. And there had been some prior work following a very hot summer a few years ago, or probably almost a decade ago. But what we really wanted to to acknowledge was that local jurisdictions have been incredibly under-resourced for doing this kind of work and for engaging in climate change adaptation work. And so if anyone were to do it, we thought that there would be a higher chance that some of the urban jurisdictions who have more resources from preparedness funding and emergency management funding might have taken a stab at or a pass at doing this work. And so we focused on urban jurisdictions for those reasons and are thus kind of limited to speaking to them. So I acknowledge that first. We were looking at, again, what jurisdictions were doing related to extreme heat preparedness and response. We also wanted to see if they had heat action plans. And so when I use the term heat action plans, I'm talking about some sort of early warning system combined with a series of public health interventions that respond to those warnings that are identified. And Reid talked a little bit about some of those potential public health interventions that could be included, including risk communications and others. We published this work, so if you want to read more, we'll put this link in the chat. It's open access so everyone can see it, but it reports on our findings in more detail than I'll discuss today. So again, we surveyed jurisdictions that were greater than 200,000, acknowledging that there's no uniform way in which jurisdictions are implementing heat preparedness and response, and that there are different lead agencies in different jurisdictions that are using different pools of resources to get this work done that has again been under-resourced. We identified contacts from both emergency management agencies and local health jurisdictions and sent a coordinated email to those points of contact and asked them to work together to provide a single response for their jurisdiction. We distributed these between September 2021 and January 2022, and we had about 97 questions, and some of them were informed by a prior survey that I mentioned that had been done nearly a decade ago by White and Newsom, and also some recent literature and guidance that had been put out by the CDC and others. So we had lots of responses, and I think 37 responses total. And we had representation from every Health and Human Services region. So the Department of Health and Human Services divides the country into 10 administrative regions. And we had responses from all of them except for Region 8. And we also had a number of responses from Region 9, in which California sits. And so we had a regional response rate of 11 out of 22 jurisdictions that we surveyed here. And then also about 6 of those 11 reported having a heat action plan in place. So more broadly, of the folks that we surveyed, the 23 reported having a heat action plan. So they had formalized their heat preparedness and response activities into a document that identified their early warning system and public health interventions. And of the plans that had heat action plans, of the jurisdictions that had heat action plans, 95.7% of those reported having plans to have cooling centers. So as Reid mentioned, cooling centers are one of the strategies that jurisdictions are using to intervene in the event of these extreme heat events. However, we found that while there were a lot of jurisdictions who were implementing cooling centers in the event that they had a heat action plan. We also found that there are a lot of jurisdictions that weren't doing things consistently. And so while cooling centers and communications were primary strategies that most jurisdictions were using, we found far fewer that were doing things like vulnerability mapping, providing access to fans or air conditioning, extending sheltering services for people experiencing homelessness, even things like conducting surveillance, which we often think of as primary public health strategies. So there were these cooling centers for people with heat action plans, or for jurisdictions with heat action plans. And I mentioned for jurisdictions with heat action plans because we actually, unfortunately, missed the opportunity to ask that question of all jurisdictions. So it was just of jurisdictions that had these heat action plans. And these communications, we're not seeing that jurisdictions are consistently adopting other strategies. While we found there were some differences between jurisdictions with and without heat action plans, for the most part, we didn't identify statistically significant differences. And this probably has to do with our sample size. We had a pretty small sample size. So it's not to say that there aren't important differences in those that have formalized their activities and heat action plans, but we didn't identify many. The two that we identified were that they had a definition of extreme heat, which is important because, as Reid pointed out, when you start to respond, you want to know what you're responding to. And so identifying that threshold for response and making sure everyone's aware of when you're going to respond is an important one to activate all of those activities. And we did see that there was a significant difference between jurisdictions that were conducting surveillance and not conducting surveillance, if they had a heat action plan or not. So surveillance is, as you all know, one of our core public health activities. And so in some ways, this might point to an indication of engagement of local health jurisdictions in extreme heat planning, and having a heat action plan may be facilitating that, that engagement, and that requires further exploration. So from these, we are recommending a few things. So one is to help local health jurisdictions get their plans into place by providing them with tools and resources and guidance for extreme heat preparedness at the local level. Again, I've mentioned a number of times that this work has been incredibly under-resourced. And so we appreciate as researchers that, we don't want to just tell folks to go and make a plan like it's easy peasy. There's a lot of things that need to be thought of and supported. And so trying to figure out how to engage federal agencies and state agencies and others to provide that support is one thing I think we all need to think about together. And then also providing peer-to-peer support, just from our overall work with local health jurisdictions, we find that they learn from one another and more so than from anyone else. And so making space for those connections to support that technical assistance and to provide best practices and examples of things that have worked and things that haven't worked, and giving them that forum, I think, is very important. We also found that while all of these jurisdictions, everyone who was doing any sort of heat preparedness and response, so not just having a heat action plan, reported that they were issuing communications. Most of these communications were very passive and technology dependent. So they were relying on social media, news alerts, the internet, and email. But the folks that they had identified in those same plans as most at risk were people who might not have access to some of the technology that they were depending on these communications for. So people with low incomes, older adults, people experiencing homelessness, people with pre-existing medical conditions, were all folks that were identified as very high risk in all of these plans. We did include children in these plans. We didn't ask about pregnant people, unfortunately, but about 31% of plans also identified children as among that risk, I think demonstrating an opportunity for some education about the risks in this population. So our recommendation here is to think about some more active and engaged strategies for communicating risk. So I highlight here New York City's Be a Buddy program, which encourages people to volunteer to check on neighbors and others in their community to see how they're doing in extreme heat events. And so I like to think about going back to basics and really relying on community connections like we did at the beginning of the pandemic to support one another in these events. So I mentioned we asked about cooling centers among jurisdictions with heat action plans. And while these were ubiquitous in those jurisdictions, there were far less plans for making sure that they were accessible to the people who might need them the most. So only 26% of jurisdictions who were reporting having or had plans for providing transportation to these cooling centers. And most of them are only open during the day, or I guess 43.5%. So not most were only open during the day. So there's far fewer that are open at night. And so that might not reach people who have to work all day, or outdoor workers who might not get any respite from the heat. So, this is really a community engaged need and need to engage the community in trying to figure out how these might work in communities. Many jurisdictions now are moving towards this resilience hub model where there's cooling centers, but also other services that are provided related to climate and other extreme events, and trying to figure out what's going to get people to go to these centers, cooling centers or resilience hubs or whatever they are in your jurisdiction, I think is something that requires asking the people that live in your jurisdiction and really knowing them, where they should be, what types of activities should be offered, but trying to figure out how you're going to get people to go to these places that need them the most, I think is an ongoing challenge that is shared across the country. Specific to infants, children, and pregnant people, I mentioned doing more targeted outreach. So thinking about how to communicate risk, particularly through healthcare providers or others, and making sure that communication materials use accessible language that makes sense to the people that are receiving them and are available in multiple languages, and that are not highly technical, and that they provide recommendations that are implementable, and that the people who are receiving them can actually adjust to be able to accommodate those recommendations. So they can't be, spend all day in air conditioning if you have to work outside, and trying to think about what is the medium for folks that are most at risk. We saw some other strategies and heat action plans that were relevant to children and mostly children, which was coordination with school districts and modification of athletic events. So thinking, deeply about ways that we can support those folks in these events. Again, I mentioned we had a small sample size. Even though we had a wide geographic distribution, it was unevenly distributed across the country of our responses. Our survey happened during COVID, so there was limited agency bandwidth, and we also conducted the survey in fall and winter when people aren't necessarily thinking about heat. I want to mention really briefly that we did some follow-on focus groups in partnership with the National Association of County and City Health Officials to better understand barriers and facilitators of local health jurisdictions preparing for extreme heat events. We conducted 4 focus groups with 3 to 6 participants each, representing 12 US states. It doesn't look like we had any California participants, unfortunately, but we did have some other West Coast, including Washington. And we found that extreme heat preparedness is influenced by local conditions. So climate, if people are experiencing extreme heat events, they might be more likely to engage in this type of work, local priorities and policies, and then how the public perceives the risk of heat, as well as local health jurisdictions' internal capabilities to actually tailor to do this work. So do they feel like they have the capability to do communications in extreme heat? And if so, that might give them more of a motivation to engage in this type of work. And again, because this work hasn't been resourced, it makes sense that folks are looking to what they have at hand and whether or not they can leverage those things in order to support this type of engagement in their community. It was also influenced by whether or not these jurisdictions had partnerships that were able to support this, and then available resources. And so beyond just capabilities to do some of the work, staffing, syndromic surveillance, access to data, sustainable funding, and ability to leverage existing resources. At the Preparedness Summit, which is a conference that the National Association of County and City Health Officials puts on every year that brings together preparedness professionals and emergency management agencies to talk about public health preparedness. We hosted a session that had 135 attendees, I think, demonstrating the real interest in this topic, where we presented our findings from our focus groups and asked participants to suggest solutions that might work given their local context in their health jurisdictions. And they highlighted here the importance of trust building, appropriate, accessible, and tailored messaging, partnerships and collaboration, and inclusive strategies that's inclusive by engaging, the most at risk in communities for successful extreme heat preparedness and response. These are some of the recommendations that they provided, and just very briefly, strengthening trust by frequenting community events, leveraging already trusted messengers, communicating early and often about extreme heat, ensuring communications are accessible, maintaining critical relationships, actively developing partnerships with organizations that serve at-risk populations, coordinating with healthcare coalitions and healthcare organizations, preparing a list of cooling centers. So some folks have standard cooling centers, others do this on a more ad hoc basis. So the recommendation was to think about this in advance. And then knowing the at-risk populations in your jurisdictions and considering accommodations that they might need in extreme heat events. And I just want to acknowledge our collaborators at UW, Boston University, and the University of British Columbia, as well as the National Association of County and City Health Officials, and note that this work was supported by the Wellcome Trust. And I'm happy to answer any questions. Thank you.
Thank you so much, Nicole. I think there's a lot of useful information here that we could learn from. I'm looking now for some clarifying questions. I don't see any. So if anyone has questions for Reid or Nicole or Francesca after she gives her presentation, please put them in the chat. So thank you again. Okay, so next we have our final speaker for today is Dr. Francesca De Donato. She is a senior researcher at the Department of Epidemiology in the Lazio Regional Health Service in Rome, Italy. She holds a PhD in epidemiology and biostatistics from Imperial College London and master's degrees in both epidemiology and meteorology. She manages the Italian National Heat Health Plan and Warning System and contributes to regional heat plans. Her research focuses on heat exposure, estimating the health effects of heat and climate change on health for public health prevention and policy. She's currently a visiting scholar at UCLA. Thank you so much for joining us today, Francesca.
Thank you very much, Rupa, and thanks for the organizers for having me here today. It's a pleasure to share work we've been doing in Italy and in Europe, and to learn so much about what is being done in California and the US, because I think one of the key aspects of heat adaptation plans and warning systems is to share information and offer the best services for the ones that are most at risk. So thanks again. So I'm briefly going to give you an overview of what we've been doing in Italy and in Europe together with the World Health Organization in terms of heat adaptation plans and warning systems. Hopefully you can see my slides. I don't seem to be changing. Can you see them moving at all?
No, they're not moving for us
Yeah.
either, Francesca.
Sorry about that. Just bear with me a second. Okay, is that better now? Yeah, I think so.
Yes, it is.
Great. So yeah, since the 2003 heat wave, which was the major event, let's say in Europe in terms of heat waves and health impacts, that most of us really put this topic on the public health let's say agenda. The WHO defined a whole series of guidance documents and information related to the development of heat adaptation plans and defined 8 core elements. Following that, in the recent years, there has been update of the evidence, and also I collaborated on this document which updated the evidence from the literature, as well as carried out a survey in the World Health Organization European area to see what is actually being done, what has progressed, and what still needs to be done in terms of heat response from a public health point of view. And the key messages that came out from the work we carried out was that warning systems and heat adaptation plans have become more specific over time. Interdepartmental collaboration at different levels, so both nationally and very locally, needs to become the current practice and needs to be enhanced, which is what Reid also mentioned earlier. Public and vulnerable groups have been identified in most heat adaptation plans across Europe, but there's limited information on what actions are actually being done. So there's only a formal identification of who they are, specifically from epidemiological studies, but it's not clear what is actually being done to these specific vulnerable subgroups when heat waves actually occur. Preparedness of health and social systems is also lacking, or it's not formally written down, so we don't have evidence of what is being done. And additional resources, funding and development needs to be carried out, and it's something that across the different member states, this was really one of the key issues, that it's a field of research on one hand, and also in terms of public health, that needs more funding and more resources, especially considering future climate change and the heat that has been growing across the European area. And again, the heat adaptation plan should no longer be standalone systems, so they should be integrated in broader climate and environmental policies. And we also know that heat doesn't happen alone. Often we have heat waves together with wildfires, for example, across most southern European areas, but I know that has happened in California and across the US as well, and in several other areas of the world. So it's really important to make sure that there's collaboration and better use of the resources we have. We also carried out a survey together with the WHO, which was web-based in the 53 European member states of the WHO, which doesn't really just look at Europe as you think of it. You can see from the map here, it stretches from the Atlantic to the Pacific coast. And out of these, only 27 countries responded. And of these, 17 countries had a heat adaptation plan in place and had changed over time. Mostly it was from Western Europe, as expected. Heat adaptation plans have been operational for over a decade in several of these countries. And as you can see here, looking at the different components or core elements of a heat adaptation plan, as mentioned by the WHO, warning systems and identifying lead bodies have been adapted by most countries, as information campaigns and definition of vulnerable subgroups. But less has been done in terms of long-term urban planning or real-time surveillance and monitoring and evaluation, which are really key aspects as well of a heat adaptation plan, because obviously the population most at risk changes over time. What has been done needs to be evaluated to see if it's working or if we need to change that as well. So all these components are really crucial. We also published a scientific paper on this, which summarized the results of the summary. And what we can see from the figure on the right is that most countries identified vulnerable subgroups to whom they target messaging and information campaigns. And there's different stakeholders also involved. But again, it's very heterogeneous when we look at, for example, the elderly are targeted in most plans, people with chronic conditions, which again goes from, also includes pregnant women and small children in several countries, is less implemented in the different countries. We obviously started with the elderly because that is where most of the impact, especially in terms of mortality, occurs, but it's not only the elderly, as we know now. The literature has really developed in the last 20 years on this, so we really need to make sure that heat adaptation plans take that into account. And what are we doing in Italy? So I'm just going to move just to what we do at a national and regional level within the Italian domain. And again, based on the work developed by the WHO, which we collaborated with back in 2003, the Italian system also started during the heat wave of 2003, which I don't know if it was a lucky event or an unfortunate event, but anyway, that's how things went. So the Ministry of Health defines, let's say, the guidance document and indications on what a heat adaptation plan should include. It manages the warning system, and it makes sure that all the information is collected at national level, and it engages national stakeholders. And these involve both public health and the Ministry of Health, obviously, but also civil protection, which is like FEMA in the US, which deals with all emergency situations in case it becomes very dramatic, and they can manage that nationally as well. It also involves environment protection agencies, which are both national and regional in Italy, as well as the meteorological services, social services and healthcare services, to make sure that everyone who needs to be engaged in this plan is aware of what is going on and everyone knows what they're doing. In Italy, public health policy and legislation is regional. So obviously the Ministry of Health gives indication, and then it is managed regionally based on their resources, on how management is carried out in the public health system. So it's really crucial that the regional really manage the actual heat plans. And then obviously, again, at this lower step, it needs to be very local, because we need to have capillary dissemination of the information. We need to have all the stakeholders involved in terms of municipality social services, for example, which can be focal point, different health services and what all the healthcare system entails, emergency services, helplines and emergency protocols at that level. So that just gives you an idea of all the different stakeholders and the complexity of the system in itself. As I mentioned before, the Ministry of Health coordinates and we manage the heat warning system for the different cities. We carry out monitoring and evaluation. So we have a rapid mortality surveillance system, which is operational in 51 cities. Emergency room visit rapid surveillance as well to monitor and see what is happening. And in terms of preparedness, prevention and response, the Ministry of Health defines and revises public health guidance. Just before the COVID outbreak, we extended it to air pollution and flooding events as well. So it operates in the same way, obviously looking at different environmental exposures. We formally identify vulnerable subgroups in Italy, which is a key component of our plan, specifically targeting our response measures, which obviously, because resources are so small and limited in terms of public health, we really need to identify who those most at risk are. So we formally identify elderly susceptible subgroups, which is not just people with which are very old, it's people with chronic conditions, and I will talk about that a bit more later. We provide advice and measures for specific susceptible subgroups based on evidence from the literature, and also training for healthcare professionals in the different fields to recognize what heat waves are, what the health risks associated to heat are for the different patients, and how they need to adjust their profession in that sense as well. And that has been an ongoing process throughout these 20 years in which the Italian Heat Adaptation Plan has been operational. And then every year at the end of the summer, we carry out a survey of prevention plans and adaptation measures put in place with the idea of sharing knowledge and information from the different cities and the different regions on what is being going on. So in terms of our heat adaptation, of our heat warning system, as was described earlier in one of the presentations, there are different indicators, different models, and they can be different. Obviously, there isn't a gold standard or the best way, everyone does their own. The important thing from our perspective is that prevention measures are modulated according to the level of warning and the level of risk. And in Italy, what we specifically focused on was defining city-specific models based on the temperature and mortality relationship. So looking at different indicators, what we really wanted to focus on was what the response was in the different cities based on the characteristics of the population, being it older, more severe chronic conditions, or just because of the local climate. So it was a whole series of different things we considered. Our models, our warnings are 3-day weather forecasts, and we predict the at-risk conditions associated to an increase in mortality. I won't go into the details of the models or the indicators that much. I just wanted to give you an overview of how they're constructed and where they're available. Obviously, they're on the Ministry of Health website. We provide information through the network, which identifies a focal point in each city, and we send all the warnings via email as well. And then we have an app where you can just download the current bulletin and see what is going on and the levels of risk as well in each city. In terms of prevention, again, as I mentioned before, in Italy, there's a great focus on susceptible subgroups and who is most at risk. So we identified who these subgroups were. Initially, we focused on the elderly, then we defined different subgroups with chronic conditions, could be cardiovascular disease, respiratory disease, kidney disease, diabetes, for example. And for all these patients, we defined specific information. Again, children, pregnant women. So really looking at what the effects were, why they were at risk, and giving information to the general public, and providing some tips and recommendations on what to do during a heat wave, who they could consult, what was going on in their city, and the response measures they could have. Just to give you a more specific idea, within our app, you can select the different subgroups that are at risk if you identify yourself with one of them. For example, we have pregnant women, pregnant people that are pregnant. It gives a very brief and summarized indication of why you're at risk when there is a heat wave. You could be dehydrated, for example, and it also says that it's in Italian, unfortunately. If you have specific chronic conditions and you are pregnant, why you might be more at risk and what you can do. It's very simple information, but then you can also download specific information leaflets, for example, and look at more detailed information. For example, what to do when you go out, what to do when your child is born, etc., etc. So there's more detailed information. We also carried out training with gynecologists and obstetricians and had information from them. We set up some, let's say, task force tables with experts in the field to define these information and recommendations from the different sectors. In terms of the survey we carried out every year, obviously this gives a better idea of the prevention activities and what is being done in the different regions and in the different cities in terms of information campaign, education and training material, the identification of susceptible subgroups and who they are, what they do for social services, emergency protocols, telephone lines, and all this information is readily available on the Ministry of Health website as well. In the last 2 or 3 years, obviously things changed. With COVID, initially we were in lockdown through all the COVID pandemic, similar to as California. And so obviously GPs couldn't access their patients with the same, or patients couldn't go to medical services in the same way. So we had to change response during heat waves as well in terms of how we dealt with those patients that were most at risk. We activated telemonitoring services, for example, or there were different helplines and things that were put in place to make sure that they could still carry on and have the same access to healthcare even during the COVID pandemic period. Just to give you a brief idea as well of what we do in terms of active surveillance and what that means, in our Lazio region, which is in Rome, where I live and where I work, we have a specific identification of susceptible subgroups, and when a warning is issued, GPs and medical services carry out active surveillance of these people that are most at risk that we identify through telemedicine services or home visits. Who are these people that are most at risk? As I mentioned, we have different sources of information and we define a vulnerability score based on the characteristics of risk. So we look at population registry for age, gender, marital status. We look at hospital admission records for health conditions to identify chronic disease that we know associated to be most at risk in patients when they're exposed to a heat wave, as well as social conditions like deprivation if you're living in a deprived area or a hotter area, if you're in a big city, which as was mentioned before, the urban heat island also plays a relevant part in this, education levels, social isolation, etc., etc. All these data is combined to define a vulnerability score. And then once we have a heat wave and a heat wave warning is issued, GPs, health districts, local health authorities and emergency services can survey those that are most at risk, so those that have a high and very high level of risk during heat waves. They are surveyed in terms through teleservices and this online platform, or GPs carry out home visits or phone calls. It's an online platform to monitor the health of the patients. And if they see that the conditions are worsening or there's something that needs to be done, they can change their medication, refer them to hospital or nursing home, activate home care services and different other aspects as well, with social services as well, where these are available. So it's a very interactive way of really knowing who the patients are and if they are at risk during heat waves. They call them up every day, but also to see if they are at risk, and we can actually do something very specifically in terms of the health. This was activated for the elderly, but the idea of the Lazio region and other regions in Italy is to extend it to other subgroups that are most at risk. For example, pregnant women, outdoor workers. A lot of work has been done, which is slightly different through agencies and different industries as well. Very briefly, to give you an overview of the mortality surveillance system and why this is important, we have mortality data coming in every day from 51 Italian cities, which have a population of 150,000 inhabitants, so the bigger cities in Italy. It's a near real-time surveillance, which gives us the opportunity to monitor the actual impacts of heat waves and to adjust response, especially in terms of emergency response in hospitals or emergency services. We can use the same data to estimate heat wave impacts, evaluate the different components of a heat adaptation plan in terms of processes and outcome. And we also obviously use the data for research purposes to identify other risk groups. Just to give you an idea of the data and what that means, here you can just see, sorry, the slides are in Italian, but you can see the trend, the seasonal trend in mortality. What we know typically is that peaks in mortality occur during winter. You can see in the orange bands the COVID pandemic and the impact that had in Italy, but also the heat wave of 2022, which was one of the most recent events we had in Italy, and how the heat wave really had a similar impact to the other winter peaks. Going into more detail on what has happened recently, July 2023, we had a massive heat wave across Europe, especially in Southern Europe and Italy, as you can see from the maps provided by Copernicus. And it was July 2023 was recorded as the highest on record in terms of global average temperatures. In Europe, temperatures were higher than average, especially in Southern Europe, with an anomaly, a surface temperature anomaly of around 2 to 4 degrees. And the percent of extreme heat stress days was 1.7% compared to 0.5 average, as you can see from the graph on the right. So it was a really extreme event. And how did this have an impact in Italy? This is more or less real live data. This was July this summer. As you can see, the heat wave was very long. It was between 10 and 18 days in most cities in the center and the south of Italy. And if we look at the impact on mortality, we see that in the north, where there wasn't really such a dramatic heat wave, the weekly mortality by age group didn't really change. There was no significant excessive mortality. While if we look at the excessive mortality for cities in the south and central regions of Italy, we see an excess of 9% when we look at the data. This data is all published on the Ministry of Health website. We also did do evaluations in terms of how, if there's a temporal change in the impact or response of exposure to extreme temperatures and the relative risk of mortality, and you can see the curves here. So the curves show that as temperatures increase, there's a higher risk of mortality in the different cities in Italy and in the different years. On the left-hand side, you see the relationship in cities in the north of Italy, and on the right-hand side, you see the relationship in central and southern Italy for the last 3 years, when we also had the COVID pandemic. So what we know from the literature is that the temperature mortality association changes over time, and it depends on previous season mortality as well. So the influence of the winter season, the flu pandemic, COVID pandemic, etc., can influence the impact on mortality. Why is this? It's because the same pool of susceptible people are exposed and are the ones that make this mostly shift. So it's really important, again, to really know who the vulnerable subgroups are and really intervene where necessary. And what we saw in Italy was that while in the north, the COVID pandemic in the last 2 years had a real strong impact, the effects of temperature were much smaller and reduced, as you can see from the green and blue lines for 2020 and 2021. While in southern Italy, we were in lockdown for longer periods, and before the outbreak hit during the first wave of the pandemic, there wasn't such a reduction in the effect of exposure to extreme heat on mortality, but there was a reduction in 2022, even if we did have really high temperatures. So there's also a difference, and it's important to look at very high resolution data as well when you're considering the differences in this. We have seen a reduction in heat-related mortality over time across Europe, as shown by the WHO work, and in Italy, but again, it hasn't resolved. So when we do have other heat waves like we had this summer, we see impacts again, as we did across Europe in 2022 in the UK, France, Spain, and several other countries. So there is a lot of work still to be done, and we need to ensure that different components of heat adaptation are evaluated and revised to make sure that we really know who is most at risk and what is working and what isn't. Information campaigns remain a central component of any heat adaptation plan, but can be more finely tailored to specific audiences. And then the way we portray the information, online or web information might not work for the elderly, for example, for different subgroups, and we need to understand that. Collaboration between different sectors, which was stressed in the previous presentation as well, is really key. And across different levels, there needs to be collaboration, both nationally, locally, and regionally. The impact of temperatures changes over time. It depends on acclimatization, on measures put in place, but also in the change of exposure, considering climate change. So this also needs to be considered when we're thinking of long-term planning. The scope and definition of vulnerable groups is changing, and public health response measures need to adapt accordingly to enhance an active response and really know what is being done and sharing information between different public health institutions. Preparedness planning and training of the healthcare system needs to be promoted, and a lot can be done on this. And we also have to remember that adaptation plans need to be integrated with concomitant environmental exposures, not only because resources are finite, but also because it's the same groups that are at risk, and we need to make sure that they have an adequate response. And that is it from me, and I'll hand back to Rupa, and I thank you all for your attention.
Thank you so much for that presentation, Francesca. It's encouraging to hear that heat response plans actually can work. And we have to just emphasize that a lot of the health effects that we're seeing from heat are preventable. So this is part of the reason we're having this session today, to really talk about response. And I don't know if anybody at this time, we have probably about 20 or so minutes for questions. Does anybody want to raise their hands and ask the question? Otherwise, I will pull some from the, looks like we have a couple from the chat, and then also some from our co-hosts. So I'd like to just see. Okay, well, everyone can think about their questions a little bit. First, I wanted to start with more of a general question, because each of you really highlighted the importance in reaching certain populations, certain high-risk populations. Can you speak to the importance of supporting local community organizations to develop education, outreach, and ability, and to organize prevention and mitigation programs? I know you talked about this already a little, but maybe some of the, a little bit more your experience with this. And this is for any of the speakers that want to respond.
So I can kick us off here. So one of the challenges that we have at the National Weather Service is our scope is very large. So we really we're actively working to try to find sustainable solutions to what you're just talking about there, because there's no way that we can develop a relationship with every single one of these local efforts, the community-based organizations, faith-based organizations, everyone who wants to help out. There's no way that we can facilitate all of that. So we really have focused on fostering the relationships specifically with public health to try to get at that, because they're at a lower level than we are. They're much more local. They're typically at a county-based level here in Washington State, and they have much closer ties in and more resources to be able to afford to getting into some of those efforts. And then we're happy to provide any support to them as they work through that. But that is absolutely one of the biggest challenges that we have, is there's just no way that we can do it all at our level. One of the other efforts that we do support here is what's called the Weather Ready Nation Ambassador Program, where those local organizations or businesses or HOAs, anybody can sign up to be a Weather Ready Nation ambassador. And then we work with those ambassadors to get them seasonal preparedness materials and other outreach materials ahead of the season, before the events occur, so that they've got those at hand for when the weather does strike.
Great, thank you. Either of the other speakers want to respond?
Yeah, maybe I can add something to that. So it's really important to really engage with the local communities and understand who they are and how they're working. For example, in Italy, apart from, as you've seen, it's a very step approach. So it goes very local within our local health authority. And what we did in Rome, we also had, let's say, more societal resilience approach as well. So really engaging with local communities, NGOs, on the territory and within the districts of Rome, which are very diverse as well, and engage with them. And we provided training to different NGOs on what the heat adaptation plan was all about, what information and what resources were provided by the local health authority. Because two of the issues we found as well was that, firstly, most vulnerable people don't think they're vulnerable, especially the elderly. They think they're not vulnerable. They can go out and, go for their shopping and go to the market at 2 PM in Rome, which is relatively hot in the hundreds, for example, or even athletes, workers, they might be working outdoors without their top on and with, things like that. So it's really important to pass the message on what health risks are related to exposure to heat waves, and not everyone is familiar with that, but also have the different people within a very small knit society, like even within Rome and the local, let's say the locals, is engaged with your buddies and who you're accustomed to. So it might be your GP, it might be social services you're engaged with, it might be people at the market, your pharmacy, it could be elderly retirement homes, or communities or areas where they meet, and have this information given to you by someone you know. Because we also found that when we were calling up people to include them in the active surveillance, they didn't know the service was actually there. They didn't believe that the local health authority was giving them this service for free. In Italy, we have a universal healthcare system, so everyone can access healthcare, which is a bit different from the US. But still, they were quite wary of the fact that they would be called up and they could have this access to additional healthcare or surveillance. And so having it from a pass through a community service was also very useful to ensure that our numbers went up and more people were engaged and involved, as well as raising the awareness at local community level. So that is definitely very important. It's really understanding how the territory works, and that's why we invested a lot on seeing on what was already available, both regionally and locally, and really engaging into that network of operational systems and how things work. Even public health means a lot of things. It could be a hospital, it could be a nursing home, it could be GPs or primary care. And you need to understand how that works on the territory to make sure it then works and engages at different levels as well. So that was our approach to that.
Very impressive how much thought has gone into the local response in Italy. Nicole, do you have anything to add, or should we move to the next question?
I would just say quickly that a lot of these local jurisdictions where the rubber meets the road, who know their communities and could do really great work in preparing for and responding to extreme heat event, again, haven't had the resources to do this kind of work. And so many of them are kind of bootstrapping what they're doing and trying to leverage existing resources, whether that be from the CDC's Public Health Emergency Preparedness Cooperative Agreement, from trying to integrate heat preparedness and response and climate adaptation into their existing service streams. And so it's really challenging to create a really robust program when you don't have dedicated resources. So I think, Reid spoke to the challenges of engaging with all of these local health jurisdictions, but on the other side of it, I think the local health jurisdictions have a real challenge engaging with partners because they don't have any dedicated capacity to doing this work. So I just want to acknowledge that, because I think that it's something that we have to address as collectively, because we're not going to really make the progress. I mean, it's very hot here in Seattle today. We're having a heat wave, and our agencies are stepping up to do what they need to do. But imagine what they could do if they had the resources that they need to be able to meet a challenge of this magnitude. And I see what they're doing with this limited amount of resources, and I'm always so impressed. And I can only imagine what they could do if they were adequately resourced to do this work, because the motivation and the innovation is there. It's just the resources have really lagged behind.
Yeah, and just to build on that a little bit, that was definitely something that we recognized up front when we were starting this work on heat after the heat dome event. And Public Health Seattle King County approached us, about working together, about wanting to get together and work on these things, because they are well resourced, right? They are the largest county in Washington State as far as population is concerned. They have a lot of staff. They had funding because of COVID. There was a lot of reasons why they approached us. Now that we've accomplished, a plan for King County and Seattle, we're trying to work with other local health jurisdictions across Washington State to spread this, to give them the framework so that they don't have to spend all of the resources to reinvent the wheel. And we started with the State Department of Health, and we've contacted now all of the local health jurisdictions within Western Washington. We've worked through, I know there's probably at least half a dozen other local health jurisdictions within Western Washington that are actively using the same framework now. The little measures may be slightly tweaked from jurisdiction to jurisdiction, but they're all using the same framework now because of the work that we did with a very well-resourced agency.
Yeah, resources and funding seem to be a big challenge here. Hopefully more people will see the importance of it, funding this type of work. Looks like Dan Wu, you have a question?
Yeah, thanks, Rupa. A great session so far. Really appreciate all the speakers and Reid, really appreciate the heat risk tool and I shared, yeah, kind of offline, but the California Department of Public Health just recently updated our heat guidance for local health jurisdictions and schools, and we're using the heat risk forecast as a central component of that, so really appreciate the work. My question, I guess, could be for any of the three folks here, is around kind of the measures we can take, right? Like ahead of time to help reduce heat buildup within homes in particular, and really appreciate kind of the emphasis of focusing on heat vulnerable populations. And so thinking about those heat vulnerable groups who aren't able to leave their homes, or and generally, you know, I think people would prefer to stay in their homes versus, you know, traveling somewhere else if they can. And so knowing there are like passive ways to cool a home, like lower cost treatments like window films or cool walls and cool roofs, but particularly things that can be distributed like through community groups or local health jurisdictions. I'm wondering if any of you have seen examples of maybe community-based organizations or jurisdictions working to like hand out things like window films or treatments that people can install in their homes. I know, you know, in California, we've had jurisdictions give out like fans and water, but wondering if there are, you know, additional measures that you've seen or examples that you're aware of.
So I don't have any specific actionable examples right now, but I know I've had many discussions now over the last couple of years about trying to develop outreach materials for, it's one thing to give out the fans, right? We've given out the box fans with the filters so people can.
Reid, you cut out. Maybe try without your video. Let's see if that works. Oh, or you're muted. Yeah.
There we go. How's that?
Perfect. Thank you.
Okay. Sorry about that. Yeah. So we hand out these box fans with the filter kits for poor air quality situations. But one thing that we don't really do is teach them how to most effectively use that to cool their space. You know, we're using it for a very specific application, but there are proper and improper ways to use fans to cool a home as well. So what is the appropriate time to open up your windows and draw the cooler air in? When in the morning should you shut your windows? All of that sort of stuff. So there's an educational component here that, and it's going to vary from home to home or home type to home type, but I think there's some outreach that can be done around just how to use those fans. And then you've got this tool, right, that you've already given out for air quality that now you can leverage for heat as well, if shown how to do it properly. But the other component of that that I've been thinking about is, you know, just a simple thermometer, right, in the house so you can see how hot it is. Because like I was mentioning, there is a temperature at which no amount of fan circulation can cool the body. And at that point, you need to take action to find a cooler space, right? And I don't know, don't quote me on the science on this, but I think that's around 90 degrees Fahrenheit inside, where, you know, if it's above that, basically you need to find another space to stay cool. And just that trigger point can give someone an actionable metric. Now that may depend on their physiology or medications or other factors, but those are a couple of things that I've been batting around in my mind that, you know, I've talked about with other emergency management folks and public health folks around here. We haven't taken any action on it yet, but it's something that we've been discussing.
I also don't know of any examples specifically, but wanted to echo Reid's point about understanding the implementation of some of these things, putting on my researcher hat. We're doing some work out in Eastern Washington where we're assessing implementation of distribution of box fan with attached MERV 13 filters and HEPA distribution for wildfires. And I think there's a lot of questions about how folks use things once they receive them. Particularly some of the folks that are most at risk, including the older adults and people with lower incomes. The electricity dependent interventions are something I think that we need to closely consider how they're being implemented, because the cost isn't just the item, it's also the cost of running it and plugging it in, and the opportunity space of where it goes in the home, especially in where there's multiple generations living in the same home. There might not be real estate for something like that, or to store it over the winter. So just to put on my researcher hat and say, I think we need to couple these distribution activities with rigorous evaluation programs so that we know if they're working and how to make sure that we're doing it better next time, and that we keep making sure that we're getting not just the things in people's hands, but the ways to use them as well, and the support they need to get them implemented. Over.
Francesca, any thoughts, or should we move on to the next question?
No, just, very briefly, it's, I think the other aspect is also different other measures like, blinds, outdoor curtains and things that can also provide shading, and natural ventilation is the other option compared to fans, or, the use of fans as well as was mentioned before, a risk factor if, it can cause dehydration as well. So it's the use of the fan that is also very important there, or even, the use of air conditioning has other negative effects or detrimental effects, thinking of climate change and, the availability and electricity bills in the deprived areas, which might be most at risk. So it's different factors and changing construction and how you would, again, be prepared on the long term. There might be some incentives. In Italy, there's been incentives from the government on retrofitting in houses, not only for when it's colder, but also when it's hotter in Italy, for example, having shades, or we have like window curtains outside to shade windows, or other things that can be done within a household that can be beneficial. So I think that also needs to be taken into account.
Okay, thank you for that. We do have a couple more questions. I know we just have a few minutes left, so I'll just try to get through at least one more. Maybe interventions. That seems to be a big topic. So what works, what doesn't? Do cooling centers, Nicole, someone asked you specifically, has that been effective? Has that been quantified? And what varies in terms of how could we make these interventions kind of generalizable? And that's a hard question, because we know that they need to be very specific to high-risk populations in local communities. But is there some kind of overarching thing that we could do to say, this works in this certain communities, but this doesn't in others? What are some major interventions that might work for most places? Because I know I've even seen in the literature that cooling centers aren't all that effective in every location, but they could be if given proper public health messaging about them. So yeah, does anyone want to just kind of comment on maybe the generalizability that includes, I know thresholds comes up a lot too, and those types of things.
I can start and just say, I think the big answer is we don't know. I think we have a lot of suspicions about what works and a lot of anecdotes. There's been a paper that recently came out about this concept of number needed to treat. So in medicine, they'll often use the number needed to treat, the number of people we need to give an intervention to for it to work on a certain number of people, or to save lives for a certain number of people, number we need to treat. And so the number we need to get to these cooling centers centers. We don't know how many people we need to get to cooling centers to prevent one emergency department visit. There have been some estimates, but it's not just the number of people, right? It's getting the people who are most at risk to cooling centers. And I think the suspicion as to why they aren't that effective is that the people who need to get there are the people who, as was just pointed out, are the ones who want to stay in their homes, like our older adults. They don't want to go out and go to a cooling center. I don't want to go to a cooling center and sit and drink a glass of water in air conditioned space, right? Like you have other things to do, and you don't want to just sit there. So there's been these efforts in trying to figure out how to get people to cooling centers. A lot of them have talked about where to place them. Are they on public transportation routes? But there also has to be some motivation to go there. And there's been talk about, in this context, are there activities for kids at the cooling centers? Are there can you work out? Can you do something productive other than just go sit in a facility to have a glass of water? We all have things to do that are not that. And so, I think we need to, again, I pointed in my presentation to start to think about how we engage communities. And this is being increasingly done related to this broader concept of resilience hubs, which hopefully are inclusive of cool spaces, and trying to talk to communities about what's going to get you here. What is a facility in your community that you would want to go to? Because we're going to see these events more frequently, and you're not going to be able to go every other week to go sit and have your glass of water in the cool space. So what can we provide you in that space that's going to make it attractive? I think we need to continue to have these conversations and to think about this very critically, because we're talking about major investments in developing these resilience hubs and other cooling centers, and we want to make sure that those investments are actually helping people.
Those are all excellent points, and also kind of brings up a lot of the reasons why we have so many challenges around trying to make interventions feasible and also effective. So Reid or Francesca, anything to add to that? No. And so we only have a couple of minutes. I will say that in the chat, somebody asked if each speaker could perhaps list or send a list of recommendations they have, particularly for pregnant and young children and for public health programs which serve these jurisdictions. So I don't know if that's something that you could maybe follow up and we can share with the participants, but I think that would be helpful if you have some of those. So maybe in the last couple of minutes, we just kind of take a closing statement from each of the speakers. Maybe something to focus on is, we've talked a lot about lack of resources. If you had all the resources that you needed, what would you prioritize? And that's for any of the speakers, if you.
So for me, like we're working on it right now, but it's getting everybody on the same page, because one of the biggest issues, problems, outcomes of the 21 heat dome event for us was that the Weather Service, public local health jurisdictions, we were all throwing out all sorts of recommendations, but we weren't saying the same thing. And that never leads to good outcomes, right? We all want to be singing from the same sheet of music, trying to say the same thing, so that there's a very clear message of what are the actions that someone should take if they fall into one of these vulnerable populations, or just to respond to this heat event. So if I could wave my magic wand, it would be having all of us be singing from that same sheet of music, having the same thresholds, having the same recommendation strategies associated with different levels of heat. That would be my wish list.
Yeah, I think that would be a priority for hopefully a lot of groups. Anything from Francesca or Nicole? Yes.
I would say, obviously resources are never enough, right? We can always improve things and they need to be improved. But I think two of the key, let's say, takeaway messages, at least from our perspective and what we've learned over the last 20 years, is collaboration and evaluation are key. collaboration always, I mean, the thing with heat waves as well is that when there is a heat wave, everyone is really latched on to the issue. When there isn't a heat wave, no one really cares and it goes to the back of the agenda sort of thing. So it's really important to keep that topic on the agenda, make sure that everybody knows what to do when a heat wave happens, because they always happen when they're least expected. Yeah, forecasts are getting better all the time. Even seasonal forecasts give us a warning of when things are going to happen. But then until they really do, you don't know what to do. So it's important to collaborate and make sure that all the different stakeholders that need to be engaged know about that, the awareness, and evaluate what is being done to really address where resources need to be allocated, because they are finite. So I would say that are the two crucial aspects. And even if resources are finite, once you get the collaboration and work with what is already in place and what really works at local level and within communities, then that's where things start to happen. That has been our experience in Italy, and resources are very small in public health in Italy. So there is margin of success, even if they're little resources.
Yeah, you still have done so much. Yeah, I agree. Collaboration is so important. So Nicole, any closing thoughts?
Other than air conditioning or heat pumps, preferably solar powered for all, I would say I would echo the collaboration piece and listening to communities and really working with communities and government agencies and academics and others, and having these conversations about what will work for particular communities. And then obviously that needs resources for the government agencies and the community partners, but also making sure that people are compensated for their time and expertise that are engaging in those conversations, and that's done in an equity forward way. And then I would also say, echo the point about evaluation. We need to figure out what works and in what context, and what additional strategies we need to employ to protect our communities.
Yeah, I think all of those things are so important for the future of heat response plans. So thank you so much to our speakers. I know we've learned a lot here in California, and we will be in touch as needed. And thank you also to the co-hosts and everyone who kind of made this day happen. Really appreciate all of your effort, namely Mark Miller, Stephanie Holm, and Rima Woods, and of course our wonderful IT department at OEHHA. So thanks again. Have a great day, everyone. Bye.